and then it also represents more than 11% of the total expenditure in 2026. Out of these amounts, we have the National Health Insurance Scheme that takes around 11 billion. And as I indicated the last time, we are voted into power to solve problems. And so we inherited some challenges with respect to the National Health Insurance Scheme. If you all recall, the National Health Insurance was capped, and it was bedeviled with delay in the payment of claims, unrealistic payment of tariffs, and a lot more, co-payment. And so since we took office, His Excellency, one of the policy directives he gave was to uncap the National Health Insurance, so it still remains uncapped. And there is now prompt releases of funds to the National Health Insurance Fund. Gone were the days where you hear service providers shouting on top of their voices on the rooftop that they were going to withdraw services because they were not receiving payment. And this is no more the case as I speak to you now. In some cases, my CEO will have to call even some of the service providers to bring their claims for payment. That is the current status of the National Health Insurance Authority. And so it is not by coincidence that there is a lot of confidence in the National Health Insurance Scheme. The coverage was around 18 million people as at the time we took office, and I can confidently report that in a matter of less than 1 year, we are around 20 million people, which represent about 60% coverage. And beginning next year, we are going to increase the tariffs in the National Health Insurance to the service providers, because it is something that the service providers have been complaining about, that the tariffs we give them are unrealistic. And so government has taken the decision to increase the tariffs about 120% on average. And I believe this is going to be a game changer.